So most welcome, Dr. and we are glad to host you today. Maybe you can go on to introduce yourself to our viewers so that they can know who is Dr. Nassib as we kick.
Thank you, Bernard. My name is Dr. Nassib Tawa. I'm a senior lecturer, Rehabilitation Sciences at Jomo Kenyatta University of Agriculture and Technology, and I'm also a senior researcher at the same department. I also happen to consult for WHO Regional Office for Africa. Thank you.
Thank you so much. And that gives us a baseline of you being the focal point of the questions that we are going to ask today. Let's start with the statistic. It's very funny to see the statistic, how they are, that 2.4 billion globally people will require rehabilitative services. In Kenya, almost 9.4 million, that's to say maybe 1 in 5 will require rehabilitative services. The WHO goes on saying that over 50% of the population, especially in low and mid-low income countries, are not able to access these rehabilitative services. It's also interesting to look at the WHO Rehabilitation 2030 initiative. They went ahead to recognize rehabilitation as an essential healthcare program that should be there for universal health coverage to be achieved. So on your opinion, what's the role of rehabilitation team in promoting universal health coverage, and how can we integrate these rehabilitative programs into all levels of healthcare system?
Thank you, Bernard, for that question. And I'll first go to the statistics that very many people globally have a condition that would benefit from rehabilitation services. That's a fact because evidence has shown the same. And this is because of the changes that have happened, the demographic changes that have happened in the global population. So currently, you understand the epidemiological transition where we have more people globally suffering from non-communicable diseases than before. Issues of, or rather the prevalence of injuries and trauma is also on the rise. Yes. And of course, the gains that have been achieved through the improvements on basic public health interventions like prevention and promotion. So we have many people, and that is not to forget the issue of aging population globally. Sure. So we have many people than before currently who have a condition that would benefit from rehabilitation services. And with this fact, many of these people actually live in the low and middle income countries like here in Africa. Sure. So the problem is more pronounced in the African region, for instance, than it is in Europe. And it is for this fact that WHO and other international development partners in the healthcare sector have recognized rehabilitation as the healthcare intervention of choice for the 21st century. So you see a lot of initiatives, a lot of focus, a lot of support moving towards rehabilitation services. And one may ask, what exactly are we talking about when we talk of rehabilitation? Yeah. So any healthcare system globally is designed to offer what you call disease preventive interventions or disease prevention. And there's health promotion services. Sure. There's also curative services. And now you see a lot of focus also in palliative care. Yeah, sure. Now, rehabilitation, therefore, is one of the key components of the healthcare system. Sure. So it is part of the core healthcare system together with or alongside preventive health, curative health, palliative care health, and promotive health. And rehabilitation is a consolidation of a couple of health professions within itself. It's more of an umbrella term than a discipline-specific occupation or profession. So when you talk about rehabilitation services or rehabilitation health services, you are referring to, we are referring to physiotherapy services, we are referring to occupational therapy services, prosthetics and orthotics, okay, speech language therapy, psychology or psychotherapy, and other elements that also support rehabilitation services. So it's a combination of all these multiple diverse disciplines which all fall within rehabilitation services. And the main focus of all rehabilitation services is to restore function and enhance participation in key life roles. So anybody who has any disease or a condition or suffers an injury, those conditions have an impact, a negative impact, therefore, on their function in daily life and their participation in society and in national development activities. And so you can see that this reason is good enough to ensure that, to rather facilitate or support the focus of African countries to ensure that there is enough accessible rehabilitation services, because we need everybody to get back to, participate fully in their life roles. Yeah,
that's a great insight.
Yeah.
So when you talk about that, the United Nations, when they were formulating the Sustainable Development Goals,
very correct.
They also said that, they also emphasized and recognized that for us to achieve the Sustainable Development Goal, especially the SDG number 3, we also have to focus on universal health coverage.
Yes.
So that goes on non-communicable diseases and all that. So what's the role of this rehabilitative team when it comes now to mitigating not only prevention, but not only treatment, but prevention and mitigation of non-communicable diseases?
So non-communicable diseases currently contribute a better share of the national disease burden here in Kenya, for instance. And again, this is a set of conditions. Talk of the stroke, diabetes, the cancer, which is quite rampant of late, and many other conditions. These are conditions which initially they used to be very insignificant, or they were known to be diseases of the rich. But now they are actually diseases of every other common Kenyan, for instance. So again, many governments, many healthcare systems invest or spend a lot of resources in treatment of these conditions. And part of the treatment measures is, of course, rehabilitation services. But back to your question, what's the role of rehabilitation services in prevention? And we know the importance of focus on prevention than curing. So if you take an example of physiotherapy services, they have an instrumental role in prevention of non-communicable diseases through provision of guided or prescribed exercise programs to monitor or weight issues of patients, general education, and many other things. So rehabilitation services, or the rehabilitation professionals generally, have an instrumental role in prevention of non-communicable diseases. And of course, we have programs which have been piloted in some countries, in European countries, but also some have been undertaken in the African region, which have proven the net value of rehabilitation services in prevention of the diverse set of non-communicable diseases. So there is a clear role which has been tested and documented that indeed, if any government can focus on prevention of rehabilitation services in order to target prevention of non-communicable diseases, then it's a worthwhile investment.
Wow,
yes.
Wow, that's great. And where should we start? Because we find most of the rural areas, there is not this information.
Yes.
Do you think there is information gap in terms of what people should be fed on in terms of the lifestyle?
Exactly. And I think that relates to your previous question on while we all recognize the importance of rehabilitation services, the question one may ask is, are these services available to every person, wherever they are?
Yeah.
And the simplest answer is no. The rehab services at the moment are more seen to be specialized services. So when you look at the organizational structure of the healthcare system, from the bottom of the pyramid, we have the community-based healthcare services. And of course, then we move to the primary facilities, secondary and tertiary. Tertiary, these are our national hospitals, are the apex of the pyramid. Now, when you look at the distribution of the rehabilitation service points, most of the services are concentrated at the apex of the pyramid. Whereas most of the people who have rehabilitation needs are at the bottom of the pyramid. So there's a contradiction in the alignment there. And therefore, yes, this information ought to be available to the majority of the people who have rehabilitation needs. But the situation on the ground is that this information does not reach the target people. And of course, we have statistics by WHO that in countries like Kenya, more than 50% of the patients who have rehabilitation needs do not have access to the service. So the patients that we see in our hospitals, in our clinics, constitutes less than 50% of the total population of people who need rehabilitation services. And the focus should not be on tertiary levels, but rather taking the service to mashinani, or to the grassroots, where most of the people who require the service are located.
Wow, that's amazing. So let's come to this issue here. It's very impressive of what you're doing, yourself and also as a department here. There is a grant that you got from the European Commission. Maybe you can tell about, you can explain about it. Also tell us about the African Assistive Technology Center of Excellence.
Thank you, Bernard. So one, with the grant that we received from the European Union, last year we formed a research consortium, which is basically, a team of universities within East Africa and Europe who are training and doing research and development work in rehabilitation. So we've got Jomo Kenyatta University, Moi University from Kenya, and then we have University of Rwanda, and the University of Global Health Equity from Rwanda, and the Kilimanjaro Medical University from Tanzania, and the State University for Zanzibar, together with YAMK University of Applied Sciences from Finland, and Bochum University from Germany. So we came together as researchers and trainers in rehabilitation, and made a proposal to the European Union that we want to undertake a project for 3 years, and the project is mainly focusing on bridging the gap in terms of access, because in as much as we are training rehabilitation professionals and letting them out to the labor market every year, we still have this problem where most of the patients who require the service are at the bottom of the pyramid, but the service points is focusing on the apex of the pyramid. So we came up with an idea to see how to bring on board digital innovations to bridge the gap. And by digital innovations, what do we really mean? You all understand and appreciate the fact that currently there's a lot of developments and innovations in the digital space. So we are looking at the potential of digitizing some of the rehabilitation interventions so that patients who come from far off areas, hard to reach areas, rural or remote areas, who find it difficult to travel to Thika or to Nairobi to attend clinics. Take an example of a mother who comes from the rural Kiambu area, who's running a kibanda, but unfortunately has a child who has cerebral palsy, who needs to attend clinic at Kise 3 times every week. So sometimes we see that we have very poor treatment outcomes because the patient is not compliant to care, because we expect the patient to travel every time to come for care. So we're looking at ways of reaching out, reverse the process. So, and we are borrowing from the developments from other areas. And so the plan is to come up with digital innovations that will enable practitioners to offer services remotely, or in cases where the client cannot come to the clinic or to the hospital. Because not everything that you do as a rehabilitation professional requires one-on-one. Some things like assessment, follow-up can be done remotely. So the project is focusing on remote or digital integration of digital innovations in our day-to-day operations as rehabilitation professionals. And already we are seeing some results into that. There's some work that has been going on in Rwanda. We have people from far-off areas who are now able to access, at least do a consultation with a physiotherapist remotely and get advice. You know, some P&Os or orthopedic technologies can evaluate a client with an amputation remotely, and, you know, take measurements and then prepare a prosthesis and, you know, courier it to the client, as opposed to the traditional way of operations. So I think this is a good project which has the potential to revolutionize the way we've been doing things in attempt to address the issue of unmet needs or improve access to rehabilitation services.
Okay, that's amazing. That's a great work. One thing I'm proud is that you have taken the step ahead, not to blame anyone or say the government is doing this or that. And also, in line with the United Nations SDG, you're also implementing reducing the inequalities and partnership for goals. But what do you think? Should this partnership just be between institution, or should it now go far ahead to state, government to government?
Exactly. I think what we are doing as institutions of higher learning, that is our role. Thinking for the government, thinking for the people, coming up with new ideas. But once the idea has been concretized, we welcome and invite every partner to be part of the process. So in this big project, I think even yourself and your team or your organization can be part of this process. Yes. So we intend to, of course, engage with the governments and the ministries and other state actors into this process.
Okay, that's amazing. Now, this is a personal question on. Is it really digitizing the services? And if it's so that people from the rural areas can access that, how will be the means, considering some are in remote areas, no network, accessibility, no power? How should...
So the program has that in mind, and from inception, and it has provision for provision. We are going to provide gadgets that has been tested. We are going to, and that's why we're also working with like the telecommunication companies to ensure that they can also contribute issues of connectivity, among other things. And that's why, again, we are inviting the state actors to see how they can subsidize some of the costs that are part of the whole process. So it's something that is doable, is relevant, and it's going to, the impact is bigger than the input. Yes.
Good. Now let's move forward to this next question. A very interesting question with training and specialization.
Yes.
Are people not able to access the services because there are not enough rehabilitative specialists, or is it because it's only the means of accessing them, like going to where the services are, or the services?
It's a combination of multiple factors.
And now how can we synergize that into training and specialization?
So one, people, as we said, more than 50% of those who require rehabilitation services don't have access to the service. And the reason is multifactorial. We have issues of financial challenges, distance, geographical barriers like distance and terrain, but also the numbers of the rehabilitation workforce and the distribution of the rehabilitation workforce and service points.
True.
So it's a combination of all those factors. If you look at the distribution of rehabilitation workers in this country, you will see that they are all concentrated in the cities and urban areas.
Sure.
But we have a lot of patients in the remote areas. Yes. So that inequality itself is a contributor to the lack of access to care.
Okay. So let's also talk about the documentation in the field of rehabilitation and physical medicine. Do we have enough document to support?
Well, if you look at the Ministry of Health, for instance, in Kenya, but not just in Kenya, I've had the pleasure to work with other African countries. There's also a problem with the information, data collection, information generation from rehabilitation. And again, going back to the several or the 5 components of any healthcare system, all the other subsectors are well developed because they've been receiving support from government and other development partners over the years. But rehabilitation subsector has been left behind in many aspects. So there's little or there's inadequate workforce to begin with. Equipment and infrastructure is very poor. It's poor also in some areas, because you would go to some areas, a sub-county hospital, and there's probably 1 occupational therapist, 1 physiotherapist. They have no space to operate. They don't have the essential equipment and all that. Financing, how much finances does rehabilitation departments, for instance, receive from county governments and national government is also very negligible, among other factors. So all these factors combined point towards an underdeveloped rehabilitation subsector and under prioritization. And again, it's because there is no data or information, credible information, to support any government. The decision makers they operate based on data. So if there is no data, you cannot support any request or any push for prioritization. So part of if you look at the WHO Rehabilitation 2030 initiative, part of the focus that we are actually asking ministries of health and other players to focus on is on generation of data and evidence for rehabilitation. And there are tools now which have been developed that are supposed to be used to collect comprehensive data to inform decision making in rehabilitation. But at the moment that is lacking.
That's a great insight. Now to the second last question. It's about now treatment and outcomes.
Correct.
How can we enhance treatment so that we can get even more better outcomes?
Okay, of course, outcomes are informed by the inputs. If you take the super specialized physiotherapist now and you put him in a facility which has no infrastructure, the outcomes will remain poor. If you have infrastructure, world-class infrastructure, but an under-trained rehabilitation worker, the outcomes will be poor. And so the outcomes are informed by a combination of several inputs. So we need, for us to enhance or improve the rehabilitation outcomes, we need to improve infrastructure, equipment. We need to enhance training, specialized training. We need to enhance our service delivery, programming, and many other factors together. So outcomes are not just determined by a single input. It's a combination of all these inputs, or what we call the building blocks of a health system. So there must be financing, appropriate financing, resource allocation to rehabilitation. There must be advanced specialized training. There must be adequate, improved, world-class infrastructure. And then the service delivery model itself should be also appropriate. With these combined, the patient outcomes will be better.
That's amazing. Now to the last question. This is an interesting question. I just want to get your input on it. What do you think about devolving the health sector? Because today, if you read about the Taifa Leo,
Yes.
there was this scandal of how the governors are misappropriating the money meant for procurement of medical
Yes,
equipment and all
yes,
that.
yes.
Do you think it was a good idea?
Well, from where I sit, that's a big question. Maybe it's a question that is supposed to be asked to the PS Ministry of Medical Services, but not me. But I can say yes and no at the same time, because there are positives in devolving or decentralizing healthcare services. Okay, it's today now you can see patients don't have to travel from the remote counties, Homa Bay, Kilifi, or wherever for blood transfusion, or rather for kidney dialysis and cancer treatment in Nairobi. A few years before decentralization, that was the case. A very critical ill patient coming with a bus from Lamu for dialysis. So it is through devolution that we are seeing decentralization of those services, specialized services, cancer treatment, dialysis, among other things. Okay, and that's a positive in a way. But on the other side also, there are some shortcomings of the whole process, because it's like some entities, there were no proper structures built at the decentralized facilities to allow optimal service provision. So again, as I said, there are positives and negatives at the same time. Maybe what we need to look at is how to strike a balance and move forward. Yeah.
So thank you so much for your time. Maybe you can give people your parting shot as we conclude.
Thank you, Bernard. My parting shot, of course, I think it's important for the general population to understand the value and need for rehabilitation services, and that rehabilitation services are for all, including persons with disabilities. And this service is an essential healthcare service, and being an essential healthcare service is therefore, it makes it a human right. So rehabilitation services should be given the due attention it deserves, because it has a clear role and contribution to the well-being, welfare, and generally the national socio-economic development of any nation. I thank you.
Thank you so much. So hope you can hear from the one and only Dr. Nassib Tawa, who is so resourceful in this area. So thank you so much once again, Daktari, for your time.
Shukran, Bernard. Shukran.